Bonjour tout le monde. Hello everyone. Bienvenue à une conférence de presse avec le chef du nouveau Parti démocratique, Jagmeet Singh, accompagné par son député pour Vancouver Kingsway, Don Davies, ainsi que député de Port Moody Coquitlam, Bonita Zarrillo. On va commencer avec quelques remarques. Ensuite, nous allons prendre des questions sur place avant d'aller aux questions en ligne. Hello everyone. Welcome to a press conference with NDP
Bonjour tout le
Leader.
monde. Hello everyone. Bienvenue à une conférence de presse.
I think, Don, you can go ahead. Yeah.
Good morning, everyone. Thank you for joining us this morning. I'm Don Davies, the Member of Parliament for the Great Riding of Vancouver Kingsway, where we gather today. I'd like to acknowledge first that we gather on the unceded traditional territory of the Coast Salish people, the nations of the Squamish, Musqueam, and Tsleil-Waututh, by whose grace and permission we live, work, and play. I'd like to thank the 411 Seniors Services Society for letting us come to their wonderful facility and to join with you here today. It's my pleasure to be here with Canada's NDP Leader Jagmeet Singh and my colleague, the Member of Parliament for Port Moody Coquitlam, Bonita Zarrillo, and our wonderful candidate for Parliament for Coquitlam-Port Coquitlam, Laura Dupont. You know, whether you're a senior on fixed income or a hardworking parent trying to take care of your kids, people are frustrated by the high cost of living. Prices just keep rising and we're getting less for our money. New Democrats believe that there are some things that you should never have to sacrifice when times are tough, like healthcare. In fact, to us, healthcare is something that every Canadian deserves as a matter of right all the time. But over 10 million people in our country avoid going to the dentist every year because of the high cost. 1/3, 13 million Canadians have no dental insurance whatsoever. That's unacceptable. To us, dental care is primary health care. In a country like ours, everyone should be able to get the health care that they need, regardless of the size of their bank account. So that's why we have fought for universal access to dental care for years, tooth and nail. But Liberals and Conservatives have consistently opposed us and voted our proposals down until this Parliament. This Parliament, because we have used our power to help Canadians and we refuse to give up. So we successfully demanded and obtained a historic national program that will provide dental care to over 9 million Canadians. We achieved this, the single biggest expansion of public health care in Canada in half a century, and a major step towards universal coverage for everyone under the power and the guidance and the courage of Jagmeet Singh, who fought for this in our Confidence Supply Agreement. So today, millions of seniors are eligible for dental care and tens of thousands are going to the dentist across our nation every week. I have heard countless stories from seniors who tell me what a difference this is making in our lives. Their experience is heartwarming. And now, beginning in June, another 4.5 million people will be eligible for the NDP dental program. That's children and people living with disabilities. By the end of this year, millions more will be. So it's my pleasure to introduce Canada's NDP leader, the person who used his optimism, his strength, his energy, a man who fights every day for people to deliver this massive public health improvement for so many Canadians. My brothers and sisters, please welcome my friend and yours, Jagmeet Singh.
Thank you so much, Don. Don, I've given lots of responsibility to. Don was health critic that helped shepherd through a lot of the negotiations when we were trying to make this happen. Is now my finance critic. I also got to give a lot of love and support to Bonita Zarrillo, who's been doing incredible work. And on the disability file, which the next phase is going to include people living with disabilities, she's been an incredible champion. And Laura Dupont is just such a fierce advocate. I can't wait for Laura to join us in Ottawa as another member of parliament on the NDP team. When we were talking about what this means for people, today I was speaking with a lot of seniors, many of whom have enrolled in the program, and many of whom have actually received the benefit. And I want to share with you what this program means for people that are seniors that are on a fixed income, that are really struggling. They're feeling like it's hard to get by. Everything is so much more costly. Buying groceries is more expensive than ever. They're worried about the cost of the rent going up. And there's all these pressures. And because of that, you've got to make sacrifices. And one of the things that seniors have told me is that they haven't gone to the dentist. It just costs too much. I've heard from people who haven't gone for years and years. Some people haven't gone for decades because it's too costly. And what this means to me, this program, what it means to me is what it means to real people. And I think about Skip, who I just was chatting with earlier today. And Skip is one of those seniors that on a fixed income, it's hard to get by. It's really tough. And so he hasn't gone to the dentist. And he was talking about it. You know, it's one of those things that you let it go for a while, it starts to catch up to you. And it's a really big part. If you don't have good dental health, it impacts everything. It impacts your smile, it impacts your ability to eat. It's going to have a really big impact on your overall health. And it's one of those things, once you let it go, it gets out from under you, things can get really bad. And he said it was just too costly. I couldn't afford to go. And what this dental program meant for Skip is he was able to go to the dentist. He's had multiple visits where they've addressed problems that were building up over time that he was not able to get addressed. He's been able to get the care he needs. His teeth are better. He's healthier. He's happier. At least that's what he told me he is. And that's because of this program. And I want folks to know, we want you to use this program. If you're a senior right now in this country, many seniors still don't know that this program is there for them. 2 million have enrolled, but I want every single senior who can qualify for this program to get it and to get out and get that care that they need. You deserve it. You have worked your whole life. You have given so much back to this country. You deserve to have your teeth looked after. And so we want to make sure that happens for you. And so I encourage you all to go to local community centers like 411 if you're in this area, but across the country, go to your local MP's office, go to your local senior center, get signed up in these programs and get the care. If you have a dentist that doesn't take it, find one that does. We're going to encourage more and more dentists to take the program. I've heard from lots of people that it's working well. Dentists are getting paid very quickly. The program does work. So I encourage dentists, sign up. This will work for you. And I encourage patients to get out there and get the care. But I also want to point to you what's at stake here. We know that the Liberals would never have done this but for us. Let's be very clear. They voted against this twice when we proposed this idea. And it was only in this recent time when we used our power to force them to deliver. They would not have done this otherwise. And let's be clear about the Conservatives. Pierre Poilievre has been very direct. If he was in power, he said this would never happen. He would get rid of this right away. He wants to cut this from seniors. He wants to cut this from your parents and your grandparents. He doesn't think you deserve dental care coverage, despite the fact that he has had it for most of his adult life, paid for by you, paid for by the taxpayer. So he doesn't think you deserve it. We want to send him a message. He's wrong. People do deserve it. Our seniors do deserve it. They deserve dignity and respect. And not only does he want to cut dental care, he also wants to cut your pension. That's what Conservatives did when they were in power. Folks often remember the Harper years when they cut pensions. He proposed doing that again. He wants to cut your pensions, cut your supports, and we're not going to let him. So our message is clear. Not only do we want seniors to take advantage of this program, but this month, the program is going to expand to cover kids under 18 and people living with disabilities. We want you to get enrolled. That enrollment is going to be online. So make sure you are following closely to the updates. When that is available, when the portal is open, please sign up and get that care as well. You Democrats will always fight for you. We will always use our power to force government to work for you. The Liberals have been out of touch, out of connect with what people are going through, and the Conservatives are what are cut. You Democrats are the ones fighting for you. I'll do that again in French, a little shorter, and then I'll take your questions. Donc, je suis tellement honoré d'être ici avec Don Davies, avec Bonita Zarrillo et Laura Dupont. Ce sont des activistes, ce sont des représentatifs incroyables dans nos communautés. Je suis tellement fier d'être dans une équipe assez forte que la mienne. Je veux aussi noter qu'aujourd'hui, on parle des soins dentaires. Et c'est vraiment important de noter qu'il y a 2 millions de personnes âgées qui ont déjà s'inscrit à ce programme. et je veux que tous les personnes âgées à travers le pays utilisent le programme parce que c'est ça, c'est là pour vous. On a forcé ce gouvernement libéral de mettre en œuvre ce programme et on a parlé de comment ça a aidé les gens. J'ai parlé avec Skip, par exemple, quelqu'un comme souvent les personnes âgées, un salaire fixe, pas beaucoup d'argent, donc elle a dû sacrifier des choses. Et une chose qu'elle a dû sacrifier, c'est les soins dentaires. Ça coûte trop cher, donc elle n'a pas visité un dentiste depuis longtemps. Donc, avec ce programme, pour la première fois après des années, elle a visité un dentiste, elle a reçu les soins dentaires et ça a vraiment changé sa vie, ça a amélioré sa santé et c'est exactement ce qu'on veut que se passe. Donc, j'encourage toutes les personnes âgées qui utilisent ce programme de savoir plus avec les centres qui donnent des services pour les personnes âgées, visiter votre député dans votre circonscription. Et je veux aussi souligner que c'est grâce au NPD que ce programme existe. Ce n'est pas grâce aux libéraux. Les libéraux ont voté contre cette idée 2 fois dans le passé. Le Bloc, ils ont voté contre cette idée et les conservateurs aussi. C'est nous qui avons forcé le gouvernement de mettre en œuvre ce programme qui aide plusieurs personnes. Je suis aussi fier de dire aujourd'hui que ce mois, on va accroître le programme pour inclure plus de gens. Ça veut dire les enfants de 18 mois et moins et les personnes qui vivent en situation de handicap. Donc, je vous encourage de suivre les avis au niveau fédéral. Et ce mois, vous devez vous inscrire pour ce programme qui va vous aider énormément. Donc, encore, le choix est simple. Un gouvernement libéral déconnecté, des conservateurs qui veulent couper tous ces programmes. Pierre Poilievre veut couper ce programme de soins dentaires pour les aînés ou les néo-démocrates qui se battent pour vous, qui forcent le gouvernement fédéral de travailler pour vous. Le choix est clair. On va continuer de se battre pour vous. Merci. Thanks so much. I'm ready for any question you might have.
All right, we're going to start with questions on site. We'll do one question, one follow-up. We'll start with Laurie from City News, Vancouver.
Yeah. So why do you think that dental coverage is important for people with disabilities? And what are we doing to ensure that we continue to move in that right direction?
Yeah, I think dental care should have always been a part of our healthcare system. It's pretty unfair that for someone who doesn't have access to a private insurance program, that they can go into their doctor's office or a hospital and get care for every other part of their body but their teeth. And it is unfair because we know how important your teeth are for your overall health. And then if you think about the struggles that people living with disabilities face, it only makes it even more difficult if they don't get access to care for their teeth. It just makes every other challenge they're up against even that much more difficult. So we think that this care should have always been a part of our healthcare system. This is long overdue, and we use our power to make sure people get access to this care. And so seniors now, and then starting this month, people with disabilities, as well as kids 18 and under. And we think it's fundamentally important that everyone in our country get access to this program. And we're starting with these groups. And eventually, by the end of the program, everyone in our country who qualifies earning under less than 90,000 will get coverage. And we really believe this is the first step towards ensuring everyone gets health care that covers you truly from head to toe. Dental care today, and in the future, we want to look at other elements of care so that everyone gets the care that they need.
Do you have a follow-up?
Yeah, and what specifically about the program do you think is most appealing to people with disabilities?
The program will provide a really broad list of services, and there is not a limit in terms of the care that someone needs. If it's medically necessary, then the care will be there for them. That's something we've heard from seniors who are worried that they've got lots of care that's been lacking because they weren't able to afford to go for years, like I said, in some cases, decades. So there's lots of things they need to do. And they're worried, well, what if I exceed a certain cap? If it's medically necessary, that service will be covered. And I think that's very important for folks to know who are seniors. There's not going to be a limit. If there's something that you need that is impacting your health and is deemed as necessary for health, it will be covered. And that applies to people living with disabilities as well. And I think that's a very strong part of this program. You go into your dentist office, a dentist office that accepts a program, and they will get reimbursed directly from the government. I think that's also really important to know that you don't have to worry about how to figure out the reimbursement. They're going to bill the government directly and they get reimbursed. So those are some of the things I think are important to know. Also important to know, the Liberals would not have done this but for us. and the Conservatives want to take it away. I want you to know we're going to keep on fighting for you.
Okay, we're gonna go to questions on Zoom next.
Sure.
We will go ahead and take questions on Zoom. Nous allons prendre les questions sur Zoom en commençant avec Valérie Gamache de Radio-Canada. C'est à vous.
Bonjour Valérie, je pense que vous êtes sur ce dé.
Oui, là, vous m'entendez mieux, hein? Voilà.
Oui, et
Oui.
ça fonctionne.
Je voudrais vous entendre sur le verdict prononcé à l'endroit de M. Trump hier. Quelles ont été vos premières réactions lorsque vous avez vu qu'il était condamné, là, sur tous les chefs d'accusation?
Je pense, premièrement, ça montre que tout le monde doit être, les lois doivent appliquer à tout le monde. Et ça, c'est quelque chose d'important. Parce que je pense souvent, Trump se comporte comme les lois ne s'appliquent à lui. Donc, ce qui s'est passé hier montre clairement une victoire pour la justice, que oui, les lois s'appliquent aux personnes puissantes comme un ancien président. Ça, c'est quelque chose de tellement important. Ça envoie un message clair. Mais ce qui est aussi important de souligner, c'est le danger d'une présidence de quelqu'un comme Trump, quelqu'un qui brise les lois, quelqu'un qui ne respecte pas les femmes, ne respecte pas les personnes, qui veut aider les personnes, les milliardaires, les ultra riches, au lieu de monsieur, madame, tout le monde. C'est important de souligner les menaces de Trump et comment c'est quelqu'un qui va faire mal aux gens si jamais il a le pouvoir encore.
Et sur l'impact sur le Canada, quelle attitude le gouvernement canadien devrait adopter là, face à M. Trump à partir de ce moment-ci, selon vous?
C'est quelqu'un qui est dangereux pour la démocratie, c'est dangereux, c'est quelqu'un qui est dangereux pour notre pays, pour le Canada, pour les États-Unis, pour le monde global. C'est quelqu'un qui est dangereux et quelqu'un qui ne respecte pas les lois, quelqu'un qui ne respecte pas les droits de la personne, c'est quelqu'un qui ne respecte pas la difficulté qu'on fait face les travailleurs. Donc, on doit nommer directement qui il est. Quelqu'un qui abuse son pouvoir, quelqu'un qui est dangereux pour la société en général.
Nous allons maintenant à Raymond Filion avec TVA. C'est à vous.
Merci, bonjour, M. Singh. Juste pour poursuivre
Bonjour.
sur les mêmes questions que Valérie, le gouvernement Trudeau nous dit aujourd'hui qu'il pourra travailler avec le prochain président, qui qu'il soit. Ce sera comment si M. Trump retourne au pouvoir? Est-ce que ce sera plus difficile, vous pensez, que lors de son premier mandat pour le Canada?
Oh, pas de question. Ça va être tellement difficile pour le Canada si M. Trump est encore le président. C'est clair, c'est quelqu'un c'est impossible de travailler avec quelqu'un comme ça. Donc, comme plusieurs personnes aux États-Unis, on souhaite qu'il n'a jamais encore accès au pouvoir. Donc, ça, c'est ce que je veux voir, qu'il perde la prochaine élection. Quelqu'un qui ne respecte pas la démocratie, qui priorise les super riches au lieu des travailleurs, c'est quelqu'un qui est la preuve qui est devant nous. C'est clair qu'il n'est pas quelqu'un qui doit avoir accès au pouvoir encore.
Et simplement en terminant sur ce sujet, est-ce que vous craignez que les divisions qu'on voit aux États-Unis se transportent au Canada? Avez-vous des inquiétudes par rapport à ça?
Oui, j'ai des inquiétudes par rapport aux divisions dans la vie politique, dans le domaine politique, oui. C'est une crainte. Et je pense qu'il y a des politiciens qui veulent faire la promotion de cette division, qui veulent utiliser les situations horribles, les situations difficiles pour encore diviser la population. Et je pense que c'est la mauvaise chose à faire. Je pense que le travail d'un leader, c'est d'unifier les gens, de reconnaître qu'il y a des problèmes dans la vie, qu'il y a des grandes frustrations, qu'il y a de colère, et puis donner des solutions et donner l'espoir pour unifier le pays, pour unifier les gens. Je pense que ça, c'est le travail d'un vrai leader, au lieu des leaders qu'on a vus comme Pierre Poilievre qui veut faire la division, faire la promotion de la division, faire la promotion de la haine, au lieu de donner des solutions et unifier la population.
Je vois que Valérie, tu as peut-être une autre question. Est-ce que c'est possible? Non, je ne vois plus de questions. I see no more questions. So this concludes our press conference. Ceci conclut notre conférence de presse. Merci.
Thank you so much. I just want to give a big thanks again to Bonita, to Dawn, and to Laura, as well as 411 Center and all the amazing seniors that we met today. What an honor to be at an amazing center like this and to meet such inspirational people. Thank you.